most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about the best exercise for L4-L5 disc bulge and L4-L5 herniation. We're going to include a couple self-tests. So
right.
Try to determine whether or not you have it. Of course, we prefer that you go to a professional and get it diagnosed properly. But
for sure,
if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. And yes, you're going to want to also go to bobandbrad.com because we're always giving something away. Go to the giveaway section at our website. This week, we're giving away a Bob and Brad grip strengthener. This thing is fantastic. I've been using it. It has increased my grip strength greatly. And I've used it for golf. Hopefully give me a couple more yards on each drive. I got to take on my brothers this weekend. Also, you can find in the contest pinned at the top of the page at Facebook. It will be there. You'll find it. We'll go to Twitter or Instagram or TikTok if you want a 60-second version of our program. Brad, take it away.
All right, Bob. I'm excited to do this video. I've had a lot of patients with herniations or symptoms at this level for all five, including myself.
Very common.
So don't get too excited. It is treatable oftentimes, not 100% of the times, through therapy. Okay.
Right.
So
you certainly want to give it a go because you don't want to look at surgery right away unless you have severe weakness.
Right. Now, if you're watching this video and you've already had an MRI and the MRI says you have herniated or a bulging disc at L4-L5 disc, let's say you've got that, but you don't have any symptoms down the leg, or in other words, there's no pain, no numbness, no sciatica, but you may have some back pain with it. That's pretty good news. It means it's not too serious.
We should say right here, Brad, that actually they do MRIs on people that are having no pain whatsoever sometimes, and they'll find disc bulge and disc herniations in them, especially as you get older. It's kind of like gray hair, wrinkles.
Right.
It's part of the aging process that things start to break down.
Right.
So don't panic when you get these diagnoses because it's very common.
Right, that it may not be a problem. Your body's adapted to it. However, if you are having symptoms down the leg, then it all makes sense. And we're going to show you a couple simple tests. Now, if you do have a diagnosis of this and you don't have pain down the leg or any symptoms at all down the leg and just minor back pain, at the end of this video, we're going to show some exercises and posture and stuff that you're going to want to do as well, even though you don't have the symptoms. But before we go that, let's talk about where is this? Because if you understand the anatomy and some of the tests, you're going to do better. You're going to have a much better chance of...
When you have increased knowledge, it always is a positive thing. It's going to make you more likely to have positive results.
Exactly. So if you look here at Sam, L4-L5, we're going to look, here's a lumbar vertebra, here's L5, here's L4, L3, and so on and upwards. And if you look, here's L5, L4, so it's your lowest two lumbar vertebra. And this yellow, then this is pretty realistic. It's about this diameter, and the nerves are kind of yellowish, more whitish actually. But it comes out here, and then it goes through the pelvis, and at this point, it is part of this sciatic nerve. There's a nerve bundle. It's just not L4, L5 nerve, or L4 is actually what we're looking at. It goes through the bundle, and as it comes down, it starts to separate, and L4 nerve root is what we're looking at the L4, L5 disc. And it comes in through the front of the leg, kind of the front of the knee, and down and into the foot. Okay, so that just gives you a general mapping of that nerve. Now, if you look here, this red bulge is a model, Sam's model of a bulging or herniated disc. This would have to be right here. And you can see where that would push into the nerve, irritating the nerve and creating those symptoms. So the whole goal is to get that bulge out of there without surgery, which is not always, but it can be possible through therapy.
The body wants to heal if we allow it. And you want to show this now, Brad?
Yeah, so I want to show you the dermatome. In other words, the location you're going to feel. Typically, it's numbness, burning, cold feeling. All these symptoms are related to a nerve pinch. And so we put some green tape on the location and the mapping of where you're going to feel it on the L4 nerve. So it's in the middle of the back. Now, sometimes I have people that they won't feel anything here, but it'll come down in the leg. Can you turn, Bob?
Yeah.
It goes to the front of the thigh, over the kneecap, down the front of the shin, and actually down to the top of the foot. And that's L4. L5 actually is part of the big toes. They kind of get mished and mashed there a little bit. So that's where a typical
pattern is, and so
There
yeah,
you go.
that's gives you a clue where the problem is at. Like if we see somebody and they come in, they got pain here, the first thing we're thinking is L4, L5.
Right, exactly.
Right.
And the next thing that you can, and this is a real simple test you can do, is a muscle test. Now, one of the muscle groups that L4 innervates is their dorsiflexion, the anterior tib. So if this is my involved side, and if you can do this, that means the nerve is not pinched so bad that it turned off that muscle group. One of the typical tests that doctors and therapists do is they say, can you walk in your heels like this? And that's a good indication if L4 is intact. Now, if you do this and your left leg is your good leg, you can do it easy there, and you try to hear it, it just plops down like that. That means you better go see the doctor.
Yeah, we a lot of times call it foot slap if it's not working right.
Yep.
Like you're walking, you hear a slap going on the right
or
side.
foot drop.
Foot drop.
Yeah. If that's the case, you need to be seeing the therapist or the doctor.
Yes.
'cause
And now remember,
does
safety first when you're doing this test. Hang on to something. I don't want anybody falling while
Yeah.
they're testing it.
you can just go like this. You don't have
Right.
to walk. You hold on to this. And if you do this and that one foot always drops like that because you cannot hold it up, that's more serious stage of
Right.
a nerve impingement. And so what I want to go to on next is, let's say you have the nerve impingement, but you
Sure.
could you pass a manual muscle test, but you have the
Some
symptoms.
pain going down the leg.
Now we got to get to the exercise. Now we're going to
Right.
go to the McKenzie routine. Robin McKenzie started a whole system treating symptoms just like this. And it's been going on since the 1960s. It's a whole worldwide system. So we're going
some countries.
Yep, we're going right to the best.
Yeah.
So Bob, why don't you show one of the most common
Sure.
exercises that works for this?
So what we're looking for here, by the way, is we're looking for the symptoms to get better on the distal, which is the furthest part away from your body. So
Right.
like what I'm looking at, let's say I get pain all the way down my leg here. What do we want to see first, Brad? We want to see that foot pain go away.
So
Or symptoms.
we're going to do the exercise that we're going
Right.
to show you in a second. And if all of a sudden, and I've had this happen with patients.
Many times.
They do 10 press ups and, my foot doesn't feel numb or
Well,
tingling
I'll
anymore.
ask them because they go, any change? And no. And I go, well, how's the foot feel? Well, I don't feel it now. I don't feel the pain. I don't feel the tingling. I don't feel the numbness.
There you go.
So that's what you want to feel.
Right.
And if it gets better and better, it starts going up further and further. Right.
Right.
This goes away. So that's all a really good sign if you're doing the exercises and that's what you're going for.
That's called centralization of the pain or the symptoms.
Right.
And the way you get that, one of the real common exercises is prone press ups, which Bob is going to
Right. So you usually start off, you might lay like this for a bit. Sometimes we even have you lay on pillows to start off with. But eventually you get up onto your elbow and maybe lay there for a little bit. But then eventually you can do what we call micro press ups. So you're not pushing all the way up yet because you're just starting these and you're not sure what your range of motion of your spine is. What you don't want to see is this.
Right.
You don't want to be, you're so stiff, you're not able to keep your pelvis down.
Right here.
If you can't keep your pelvis down, just keep it down as far as you can and just start some, again, micro press ups.
Now, if you do 10 micro press ups and all of a sudden the foot starts to feel better, boy, you are gold. There's a really good chance that if you continue this progression, you're going to get rid of that leg symptoms.
Right, that's a very good sign. And then eventually, if you can get up to this point,
Oh, yeah.
you're going to start seeing some real gains if
Right.
you can keep the pelvis down. Now, if you do these and it's not getting better or if it's even getting worse, then you need to try some of these advanced things.
Right. Should we
So-
go to the banana?
Sure, let's go to the banana. Let's say, I know just for their sake, let's say the pain is on this leg, Brad.
Sure. Yeah.
I would actually shift my hip away from the painful side and I would shift my shoulders over to the painful side. So if you're looking at me, I'm making a banana.
If you if you look from the top down, yeah, his body curves, so that the
I'll
painful side
exaggerate
is
it
on
here.
the concave side, if
The
you will.
concave side,
There
right?
you go. So it looks like a banana looking from the ceiling, and then in that position, you actually do some mini press ups.
Yeah, and I would even a lot of times, but I maybe have them lay like this first, and then maybe even get up on their elbows again,
Sure. Yep.
just to see how they're doing. Sometimes people just wiggle back and forth a little bit here, and then yeah, we try some press ups again, just some micro press ups. You don't do full ones with this in this position,
Right. Exactly.
and again, you're looking for the same thing. Is that taking the pain out of the foot, out of the leg? You
Mhm.
know, is it going up the leg, or is the numbness or tingling getting better?
Right.
It doesn't always just have to be the pain.
Right.
It's
Exactly.
if anything is improving. Did you? Oh, you want to do roadkill too?
Yeah, we could throw one more advanced one in
So
there.
roadkill, I would actually take the leg and go like this.
Yep.
I'm putting my foot against my opposite knee.
It's kind of hard to see black on black, but his foot is against
Yeah.
his knee here.
And this is the same thing. I'm going to start this way, and maybe just lay here for a bit. I might lay on my elbows a little bit, the prone prop. I might wiggle a little bit, and then I might try some press ups like this.
And you know, Bob is saying might do this, might do that, and that's the way it is. We have
Yeah,
to kind
it's
of
an
work.
experiment.
The whole idea is that these positions are going to get that bulge to centralize, go back in, take pressure off the nerve. So be patient with it. We do have other videos if you do Bob and Brad sciatic.
Well, actually, we have a whole series on this,
Right.
Brad. So if you go to bobandbrad.com, go to the program section,
Yep.
and look for sciatica. We have 40 videos on sciatica.
Right.
And so we go into great detail on all of this.
Right.
So,
and you can go pick out the video, leg pain, difficulty reducing leg pain.
Right.
Pick that video out and isolate it.
You want to go over a few more things, though, that you want to do, Brad?
Yes. Now, the other thing, particularly, regardless of whether you have symptoms, you have a bulging disc, or you have the pain down the leg, is posture.
Right.
Seated posture in particular.
A lot of this was probably caused by bad posture in the
Right.
first place. The slumped bad posture may have contributed to your bulging disc.
Or it could have been the whole start of it, possibly.
Right, right.
For sure, you know, if you have a throw pillow, that can be helpful, but they're not always the best. But it's still a step in the right
Especially
direction.
in a couch or a soft chair.
There you
Like
go.
a recliner.
You're going to know it's the right thing because as soon as you put it in there, it's going to feel like, oh, that feels like really good support. Everything feels better. This is a little bit broad. If you have an L4, L5, you probably need something more specific. You could start out with a towel roll. You just roll it up like this. We put tape on it, and about this size may be good for you. And you're going to put it right about at that area, at the belt line area. The position is going to be critical, but you'll know. It's like, you go back there, it's like, boy, it feels like it's too high. Then just shift it down, and it's like, oh, that feels better. It's that
I would highly
obvious.
recommend it for your car, that if your car doesn't have lumbar support that you can adjust, I would try a towel.
Yep.
Eventually, if that towel feels fine, pick out a lumbar support off the internet, and that's actually a McKenzie roll.
Right.
McKenzie.
Yeah.
And it's actually, you want to get one that fits you. Like
Right.
if you're a thin guy, you probably want a thinner support. If you're a big person with a large buttock and a large gap here,
Yep.
then you want a larger support. It's
Right.
as simple as that.
Yeah. And there's so many varieties of these. You have to look at them carefully on the internet. And there is a little bit of a chance that's the wrong size,
Yeah.
but they're squishy, they're soft, and they're more comfortable than a towel roll typically, and you'll use that. Now, the other thing I want to address is posture when you're standing, or if you're going to bend over to pick something up.
Yeah, because a lot of, again, you can trace the start of a lot of disc bulging and herniations to poor bending or poor lifting. Yep. Rounding out your back like that.
Yep. So if you take a stick about 5 foot long or so, we use a booyah stick. You can use a broomstick or anything that's straight. You'll see what I'm going to do here. I'm going to put it, and I use this with my patients to train them how to do proper body mechanics for lifting.
He needs to have 3 points of contact.
There,
He's got a contact on his head, mid back, and low back.
And look how straight I am. That
Yeah.
takes pressure off that bulge. And I'm just going to practice squats. Now, the reason I'm doing this, I'll say do 10 of these 3 times a day. And then use that same body mechanics when you squat to pick something up. You can go down on one knee if you're going to pick up even a pencil, because we don't want to do this and get that bulge to come back out.
Yeah, you want to picture like that stick is in place even when it's not.
Right, exactly.
Visualize it. So
that's actually bonus, because we only said one exercise. But primary exercise is the press ups.
right.
But the posture and the mechanics of bending and lifting are very important.
yeah.
So-
Remember, Brad and I can fix just about anything
Except for
a broken heart.
there you go, Bob. But we'll continue to
we'll
work
stick
on
to
that.
it. We'll stick to it.
Mhm.